next guest is a stage 3 breast cancer survivor who is a Harvard-certified emotional intelligence expert, and she teaches women how to empower themselves, listen to their bodies, and advocate for themselves and thrive after chemo. Joining us now is healthcare and emotional intelligence consultant Sahar Paz. Welcome.
Hi, ladies. Thank you for having me on.
Yeah, you know, I want to introduce you to my special co-host, Missy, today. She is a co-worker, a friend, and a breast cancer survivor, and I know this came into play for her. Emotional intelligence is so incredibly important to thrive as a cancer patient and survivor.
And you spoke... That is so true. You know, emotional intelligence at the core is being able to perceive, evaluate, and control your emotions. And from the moment you feel something's off with your body to being diagnosed appropriately to starting and finishing treatment and so on, you have a slew of emotions that you're going through. And why it's important to be able to perceive, evaluate, and control, it all comes down to stress management. When you're stressed, your body puts out stress hormone. And what does that do? It beats up your immune system, and we need to be strong in our immune system. So really the foundation there is being able to manage your emotions so that you're managing your stress.
And one of the things you had spoke to your doctors about was adjusting that chemotherapy treatment to better suit your needs, and they listened. So what advice do you have for patients who are nervous about speaking up to their specific doctor?
Listen, we have so much admiration and respect for our healthcare professionals, so that doesn't mean that's going out the window. But as you begin to gain the self-awareness through emotional intelligence, you're also feeling your body. And so really starting that two-way conversation was something I did in the very beginning. So before that hard conversation happened about me not feeling like the medicine was working, I had already established a rapport. Sometimes that was simple as saying, how is your day, going today? And so asking them how they're doing. So it's important to remember that these are people, not people that need to be on a pedestal, and they're people who need data and information about your body. So the more that you can articulate it, the more information they have, the better your treatment plan is going to be.
You know, I remember my late mom, who was a breast cancer survivor. It was important to her to not feel like a victim when she was going through her treatment and, and post-care. So how do you help educate women about, alleviating that feeling when they're trying to educate their family and friends to support them?
Absolutely. I think one of the things first that I decided on was who in my friends and family and even colleagues were going to know. And this was me understanding that I'm going to have a lot of questions coming back to me, and repeating the word cancer, or repeating that I'm not feeling well, could tiptoe me into feeling like a victim. So perceiving, evaluating, and controlling your emotions means, okay, I'm honoring how I feel today, and I'm going to honor how I'm going to play with it. Something else that really worked for me across friends, family, and even my doctors and colleagues was naming the two masses I had, Thelma and Louise. So people had a lighthearted way to approach the conversation. When I was in a public setting with people that maybe didn't know about my cancer story, we were still able to talk about it. So naming your cancer really allows you to step away from it, and it doesn't control the conversation.
Yes, and you've been through a mastectomy, so what empowering tips can you share with our audience?
Yes, I went through a partial mastectomy in the spring, and I'm going to go fully flat this winter. And I'm really fortunate to have RNs in my life. Something that I found surprising was the same day that I had my partial mastectomy, I was sent home. And luckily, they had packed the car with pillows. So under me, behind me, in front of me, to my right and to my left, it felt like I was floating on a cloud, and that was really helpful because even the smallest bumps can be pretty painful. So that was something that was important for my ride home. And then in the weeks to come, as I was accepting my new shape, in the times when I wasn't really ready to maybe visually take in what was happening, I would just use my other senses, meaning placing my hands, focusing on the touch, on my chest to feel my new shape, to allow my brain to understand what was happening in a different way other than using my eyes. So lots of pillows and placing your hands on your chest to help you understand where your body is.
We're looking at some pictures of you along your journey. Sahar, what a pleasure it is to meet you, and we're so grateful that you were able to join us today to share your story and inspire a lot of other women along the way.
Thank you so much for having me.
Absolutely, and I'll connect you to Sahar on our website.